detailed exploration of the 5th month of pregnancy, covering the biological process, mother's body changes, baby's development, nutrition, emotional health, medical care, precautions, and lifestyle. Written in clear, natural, and educational English, perfect for articles, blogs, or YouTube scripts. Tulip 5th month of pregnancy. Complete process and procedure explained. Herb introduction. Pregnancy is a beautiful and transformative journey that takes a woman through many emotional and physical changes. As you step into the 5th month of pregnancy, you are now in the 2nd trimester, which is often considered the most comfortable and enjoyable phase of the entire pregnancy. The fatigue, nausea, and morning sickness of the early months usually fade away, and you begin to feel a new connection with your baby through tiny movements inside your womb. This month is full of exciting milestones. The baby's body becomes more developed, the mother's belly grows noticeably, and medical scans reveal many important details about the baby's growth and health. Understanding the 5th month of pregnancy helps you appreciate the miraculous development happening inside and prepares you for the upcoming months with confidence and care. Calendar: how to calculate the 5th month of pregnancy. Pregnancy is measured in weeks, not just months. A full-term pregnancy usually lasts 40 weeks, counted from the first day of your last menstrual period, LMP, even though conception happens about 2 weeks later. First month, weeks 1-4. Second month, weeks 5-8. Third month, weeks 9-13. Fourth month, weeks 14-17. Fifth month, weeks 18-21, or roughly 17-20 depending on the calendar. So if you are 17 to 21 weeks pregnant, you are in your 5th month. To calculate easily, note the first day of your last menstrual period, LMP. Count forward 20 weeks. That marks the end of your 5th month. Example: if your last period began on June 1, by October 20, you would complete 5 months of pregnancy. Baby's growth and development during the 5th month. By the 5th month, your baby is growing rapidly and beginning to look more like a newborn. The baby is about 16-18 centimeters long and weighs around 250-300 grams, about the size of a banana. This month brings incredible developments in the baby's bones, organs, senses, and movements. Week-by-week development. Week 17. The baby's skeleton is hardening from cartilage into bone. The umbilical cord becomes thicker and stronger, carrying nutrients efficiently. Sweat glands start forming under the skin. The baby can move joints and even begin to practice breathing motions. The body is now covered with a fine, soft hair called lanugo. Week 18. The baby's ears have moved to their correct position and are starting to function. The baby can now hear sounds, including your heartbeat, voice, and digestive noises. The nervous system develops rapidly. Messages travel between the brain and body. The mother might start to feel quickening, the first faint fluttering movements. Week 19. A white creamy substance called vernix caseosa forms on the baby's skin to protect it from amniotic fluid. The baby's genitalia are fully developed, and the sex can be identified on an ultrasound. Hair and eyelashes continue to grow. The baby begins sleep and wake cycles, resting for long stretches. Week 20. The baby weighs about 300 grams and measures around 18 centimeters. The baby begins to swallow amniotic fluid, helping digestive organs mature. The brain is developing nerve centers for taste, smell, hearing, and vision. The baby's heartbeat can be clearly heard with a stethoscope. By the end of the 5th month, the baby's growth accelerates, and the body catches up with the head in proportion. The baby starts practicing movements that prepare for life outside the womb. Pregnant woman: what happens inside the mother's body? As the baby grows, your body adapts in incredible ways to provide space and nourishment. Physical changes. Baby bump growth. The uterus expands and rises up to the level of your belly button, making your pregnancy clearly visible. You might notice your clothes getting tighter around the waist. Weight gain. Most women gain around 1-2 kg, 2-4 pounds, during the 5th month. Healthy weight gain is vital for baby's development. Breast enlargement. Breasts grow fuller and heavier as milk glands continue to develop. Some women experience mild leakage of a yellowish fluid called colostrum, the baby's first milk. Stretch marks. As your skin stretches, you may see reddish or purplish streaks on the belly, thighs, or breasts. Moisturizing and gentle massage can help reduce their visibility. Increased blood volume. Your body now produces nearly 40–50% more blood to nourish the baby, which may cause mild swelling in feet and hands. Digestive changes. The growing uterus pushes on your stomach, which can lead to heartburn, constipation, and indigestion. Backache and leg cramps. Hormonal changes relax your ligaments, and your shifting posture can strain the back. Cramps are common, especially at night. Brain hormonal and emotional changes. Estrogen and progesterone levels remain high, supporting baby's growth, but also affecting mood and energy. You may feel happier, calmer, and more confident now that the early pregnancy discomforts are gone. Occasional mood swings or anxiety about the baby's health are normal. The bond with the baby deepens as you start feeling movements. Medical checkups and procedures. Regular medical visits are crucial during this month to monitor your health and the baby's growth. One anomaly scan, mid-pregnancy ultrasound. This is the most important test of the 5th month, usually done between 18–22 weeks. It checks baby's organs, brain, heart, spine, kidneys, limbs, placenta's position and blood flow, amniotic fluid levels, baby's growth measurements, gender, if allowed in your region. The scan can detect any structural abnormalities early and helps doctors plan care. 2 blood and urine tests. Hemoglobin test checks for anemia. Blood sugar test screens for gestational diabetes. Thyroid check ensures hormones are balanced. Urine test detects protein for preeclampsia or infection. 3 blood pressure and weight monitoring. These are checked at every visit to identify early signs of complications. 4. Quadruple screening test. This test measures levels of 4 substances, AFP, HCG, estriol, inhibin, in your blood to assess the risk of chromosomal or developmental conditions in the baby. Green salad nutrition and diet in the 5th month. Your baby's bones, brain, and muscles are growing rapidly, so a balanced diet becomes more essential than ever. 4 essential nutrients. Protein builds baby's tissues and muscles. Sources: eggs, fish, chicken, lentils, beans, tofu. Iron prevents anemia and supports red blood cell production. Sources: spinach, dates, red meat, whole grains. Calcium strengthens baby's bones and teeth. Sources: milk, yogurt, cheese, sesame seeds, broccoli. Folic acid supports brain and spinal cord development. Sources: green leafy vegetables, oranges, peanuts. Vitamin D helps calcium absorption. Sources: sunlight, fortified milk, eggs. Omega-3 fatty acids develops baby's brain and eyes. Sources: fish low in mercury, walnuts, flax seeds. Fiber prevents constipation and maintains digestion. Sources: fruits, whole grains, vegetables. Droplet hydration. Drink at least 8–10 glasses of water daily. You can also include coconut water, fresh juices, or milkshakes for hydration and nutrients. Prohibited foods to avoid. Raw or undercooked meat and eggs. Unpasteurized milk or cheese. High mercury fish, like swordfish, mackerel. Excess caffeine. Junk and fried food. Person-female exercise and physical care. Mild to moderate exercise keeps your muscles strong, improves circulation, and helps control weight gain. Recommended activities. Walking improves stamina and circulation. Prenatal yoga relieves stress, back pain, and improves flexibility. Pelvic floor exercises Kegels strengthens muscles for childbirth. Stretching reduces cramps and joint stiffness. Always consult your doctor before starting or changing an exercise routine. Posture tips. Stand straight with shoulders back. Avoid bending forward suddenly. Sleep on your left side to improve blood flow to the baby. Use a pillow between your knees while sleeping. Lotion bottle common symptoms and home remedies. Symptom cause relief tips. Heartburn, pressure from uterus on stomach, eat small meals. Avoid spicy foods. Constipation, hormonal slowing of digestion, increase fiber. Hydrate, light exercise. Back pain, postural strain, use cushions. Light massage, yoga. Leg cramps, lack of calcium/potassium, stretch legs. Massage, eat bananas. Swelling in feet, fluid retention, elevate feet. Wear comfortable shoes. Varicose veins, increased blood flow, avoid standing too long. Use support stockings. 2. Heart's emotional well-being. The 5th month brings emotional stability and a deeper sense of joy. You start forming a real connection with your baby, especially when you feel those first little kicks. However, occasional mood swings are normal due to hormonal changes. Emotional care tips. Share your feelings with your partner or close friends. Practice deep breathing and meditation. Read about childbirth and baby care to prepare yourself mentally. Spend time outdoors. Natural light boosts mood. Listen to soft music or talk to your baby. They can hear you now. Woman medical doctor visits and precautions. Doctor visits. Maintain regular prenatal appointments every 4 weeks. Ask about vitamin supplements, iron, calcium, folic acid. Discuss any unusual symptoms like severe pain, bleeding, or dizziness immediately. Precautions. White heavy checkmark, avoid self-medication. White heavy checkmark, wear seat belts correctly, below the belly. White heavy checkmark, avoid exposure to toxic chemicals, smoking, or alcohol. White heavy checkmark, get enough rest and sleep, 7-8 hours daily. White heavy checkmark, avoid stress. It affects both you and the baby. Brain-baby-mother connection, building a bond. At this stage, your baby can hear and respond to external sounds. Talking, singing, or reading aloud helps in emotional bonding. The baby recognizes your voice after birth, so these early conversations matter. Try keeping a pregnancy diary to record your feelings, movements, and experiences. These memories become precious keepsakes later. House with garden, preparing for the next stay. By the end of the 5th month, you're halfway through your pregnancy. This is a good time to begin light shopping for baby essentials. Prepare your birth plan and discuss options with your doctor. Take a maternity class to learn about delivery and newborn care. Maintain a healthy sleep schedule and avoid stress. Warning signs to watch for. Contact your doctor immediately if you experience heavy bleeding or fluid leakage, severe abdominal pain or cramps, persistent headaches or blurred vision, sudden swelling of hands, face, or feet, reduced or no fetal movements after they start. These could indicate complications like preeclampsia, infection, or preterm labor, which need prompt care. Cherry blossom conclusion. The 5th month of pregnancy is a magical period filled with growth, connection, and comfort. Your body is actively nurturing a new life, and your baby is becoming more human-like every week. By understanding the process, maintaining a healthy diet, attending regular medical checkups, and caring for your emotional and physical well-being, you ensure a safe and happy journey ahead. This is a month to enjoy motherhood, to bond deeply with your baby, and to prepare with confidence for the months to come. Every heartbeat inside you is a reminder of life's greatest miracle, and you're its beautiful creator.